What you need to know about coronavirus on Thursday, May 14th. A version of this story appeared in the May 14 edition of CNN's Coronavirus, Fact vs. Fiction newsletter. Sign up here to receive the need-to-know headlines every weekday. The delicate dynamic between President Donald Trump and Dr. Anthony Fauci appears to be fraying, as Trump on Wednesday broke with the leading U.S. expert who has become a voice of calm and reason amid the White House's chaotic coronavirus response. Trump said he was surprised by Fauci's warning that getting businesses and schools back open too quickly would lead to unnecessary suffering and death. To me it's not an acceptable answer, especially when it comes to schools, Trump said, in the most pronounced clash yet in the tussle between science and politics that has long plagued the administration's coronavirus fight, as Stephen Collinson writes. The public row comes as Dr. Rick Bright plans to testify to Congress today that the White House was underprepared for the pandemic. Bright filed a whistleblower complaint last week alleging he was removed from his post in retaliation for opposing the broad use of a drug frequently touted by Trump as a coronavirus treatment. Without clear planning and implementation of the steps that I and other experts have outlined, 2020 will be the darkest winter in modern history, he will warn, according to his prepared testimony obtained by CNN. Nearly every U.S. state has now eased its lockdown, and Wisconsin's Supreme Court on Wednesday struck down a stay-at-home order. Crowds of people were photographed in bars and restaurants just hours later, images on social media show. For the latest on the pandemic, tune in at 8 p.m. Eastern Time Thursday for a CNN Global Town Hall. Anderson Cooper and Dr. Sanjay Gupta will be joined by Greta Thunberg, former Health Secretary Kathleen Sebelius, and former acting CDC Director Richard Besser. You asked. We answered Q. How expensive will air travel be after the COVID-19 crisis? A. It will depend on a lot of changing factors: demand as lockdowns are lifted, the price of oil, whether social distancing will be required on flights, and the possibility of tourism promotions. Airlines are adjusting for demand. This agility is key to allowing them to continue offering airfares as affordable or as normal as the public were accustomed to paying prior to the COVID-19 crisis. Read the full story here. Send your questions here. Are you a healthcare worker fighting COVID-19? Message us on WhatsApp about the challenges you're facing, +1 347 322 0415. What's important today? Who says coronavirus may never go away? The novel coronavirus may never go away and may just join the mix of viruses that kill people around the world every year, Dr. Mike Ryan from the World Health Organization said Wednesday. This virus just may become another endemic virus in our communities, and this virus may never go away. HIV hasn't gone away, Ryan said. I'm not comparing the two diseases, but I think it is important that we're realistic. I don't think anyone can predict when or if this disease will disappear, Ryan added. Germs spread fast. Here's how that looks. A viral video from Japan visualizes how easily germs and viruses spread in restaurants. The experiment, conducted by public broadcaster NHK in conjunction with health experts, simulates the atmosphere at a buffet restaurant or on a cruise ship, showing the impact of one infected person on 10 others. A separate study also shows how the coronavirus can linger in the air for more than 8 minutes after talking. More cases of rare syndrome in kids expected. Parents, hospitals and clinics should expect to see more cases of a mystifying condition that seems to be affecting children after a bout with COVID-19, doctors have said. The condition, called multisystem inflammatory syndrome in children, appears to be a post-viral syndrome, they say. Doctors are investigating cases in at least 150 children, most of them in New York. But a CNN survey finds hospitals and clinics in at least 17 states and Washington, D.C. are checking into suspected cases. A new peer-reviewed study, published in the medical journal The Lancet on Wednesday, also found a rise in the number of cases of the syndrome in the Bergamo province of Italy shortly after the coronavirus pandemic spread to the region. England gets back to work in a divided kingdom. Photos of busy commuter trains in London have raised concerns of a second wave of infections in the UK, just days after Boris Johnson called on millions in England to get back to work. The government's response and messaging to the public has been criticised as both unclear and reckless. The other nations of the UK, Scotland, Wales and Northern Ireland have kept more stringent lockdowns in place, a divergence that threatens the UK's unity, Luke McGee writes. Virus brings new lows to U.S.-China relations. Relations between the United States and China have sunk to new lows in the wake of the coronavirus outbreak, Ben Westcott writes. Trump blamed China for the global pandemic again yesterday, claiming Beijing could have stopped the outbreak, which he labeled as the worst attack we've ever had on our country. Earlier on Wednesday, China's foreign ministry said that the U.S. should focus on fixing its problems at home and stop spreading disinformation. On our radar, the U.S. unemployment rate will peak at 25%, rivaling the worst period of the Great Depression, Goldman Sachs has warned. When a 3-Michelin star restaurant in Virginia opens its doors, its patrons will get to dine among mannequins. It's one attempt to offer a full dining experience while complying with distancing measures. Explaining the pandemic to kids isn't easy. So this mom set out to help by recreating popular children's book covers to explain the pandemic to children. Cats can infect other cats with the coronavirus, but they may not show any symptoms, according to a new study. But experts say there is no evidence felines are contributing to the spread of COVID-19. Abai Rorig had just turned 18 when he decided he would donate a kidney to save a stranger's life. He's now one of thousands of people who want to be exposed to COVID-19 for science. It's not quite the Popemobile, but for nearly 2 hours, this priest in Philadelphia blessed his parishioners from the back of a red pickup truck. A 113-year-old woman, thought to be the oldest in Spain, has said she feels fine after surviving a brush with coronavirus. Fish at the Cairns Aquarium in Australia are lonely and moping around, missing their interactions with the public. Today's top tip: from migraines to asthma to shingles, coronavirus-related stress takes a physical toll on your body. We're living in a sea of stress hormones every day, said one stress management expert. The stress hormone cortisol just ravages our bodies when it's dumped into our system repeatedly. But there are some things you can do. Experts say exercise, staying socially connected, and mindfulness and meditation are some key ways to ease tension. Calming exercises like yoga and Tai Chi help too. Read this story for more tips. Today's podcast: I think that this is a huge opportunity for us to keep talking about the biggest issue that our industry has, which is labor. The issue of jobs and low wages, and like terrible workplace environments, that has always been the bane of this industry. Irene Lee, owner of restaurant in Boston: during this pandemic, restaurants have no longer been able to perform their role as social and cultural hubs. Even when they reopen, they may not function as they did in the past. CNN chief medical correspondent Drive Sanjay Gupta talks to industry experts about the future of dining. Listen now. Click subscribe to receive the latest news.